All right, we're recording them.
Recording now?
Recordy.
Episode 31?
Yeah.
Oh, we'll cross the 30 barrier, bro. This episode of the podcast is brought to you by Alpha Counseling. Alpha Counseling is the largest and most respected provider for justice-involved clients in need of sexual offense-specific treatment services. You can be confident that the treatment you will receive with Alpha will help you keep you out of the criminal justice system. All Alpha clinical professionals are trained and certified in cognitive behavioral interventions for sex offending, an evidence-based program for strategies for avoiding sexual offending and related behaviors. Anything else about Alpha other than that we're awesome?
You know, that covers it.
Yeah, I think so. Should we get started with episode 31?
I say we do it.
Let's do it.
Now. Music time. Okay, now we're live. Almost
Stress
live.
reduction.
Almost live?
We're live. It's not live, but
Streaming
We're
straight,
going.
streaming straight to YouTube in our new studio,
Yeah.
our Salt Lake studio.
Salt Lake
That's right. We
by
had
the
to
nursery.
switch location.
Not by
Yeah,
that.
with plants.
Yeah, plant nursery. Why do they call it a nursery?
I don't know. It's really weird.
Never understood that.
What? Yeah, but what else would it be called? All I've ever known it is as a nursery. Like, what would you call it?
Why can't they just call it a greenhouse?
Well, it's not. I guess he has greenhouses over there.
Yeah, but
I always like when he has a sign up there that just says pansies, like huge.
It's just
like
talking
he's
trash.
I love
pansies.
he only sells pansies though. Just the pansy outlet of America.
Why is it called? Maybe someone knows, but a
Yeah.
nursery.
Well, I mean, I know that like when they're like little baby seedlings or whatever, they like grow them up and all that. But
Clearly, we're not in the loop.
Yeah.
Don't you grow up the plants in there or something?
oh, that's a loop I don't want to be in though, son.
Dude, like three idiots talking about like remedial botany concepts. Just like baby seedlings and
Still though, you could pick a better name for the place where you're
The
housing
nursery?
those things. Yeah.
Yeah.
Like, I mean, I don't know.
plant house.
It just
Plant place.
It always made me see, like, who picked these names along the way of these things? You know what I mean? Like
Like who came up with words?
yeah, well, not words, but like, I'm just saying, like a plant nursery. Like, if you just said, "I need to go to the nursery," people could interpret that so many different ways. You know what I mean? Well, I guess only two, but still,
The options are endless.
well, right. But I mean,
Endless.
it's just open for misinterpretation. Not to mention too, like somehow flowers got a good rap. Like if you think about flowers, they all got really good names, like pansy.
Except for pansy. That's not good.
That's not bad though.
Kind of an
bad.
insult.
Pansy's all right, or daffodils, or tulips.
What would be
Or
good about
rose.
being called a pansy, though?
Yeah.
Well, nothing.
The rest of them, your argument holds up, but pansy, it doesn't.
But
There's
imagine,
probably some stupid flower names, though.
imagine though, if you just like. That's kind of when it comes down to like STDs, is who came up with the name for STDs? Because no STD sounds good. Like, I mean,
Hold
like,
on, there's one here. I was just looking, not STDs, but I typed up stupid plant names. There's one called monkey face orchid,
yeah, but even then though, so an orchid sounds okay. But if you're saying like,
bat plant.
okay, like name an STD, the name of an STD that rolls off the tongue. That if you didn't know that word, like it would sound nice.
Gonorrhea.
Like, gonorrhea. That's not. And no, you couldn't call a plant a gonorrhea.
The corpse flower. That's kind of cool.
Yeah. Or chlamydia. Herpes.
Here's one that's awesome. Hooker's lips. But they
Hooker's
kind
lips?
of do. Look at that.
Wait, is that a plant or an STD?
Yeah, both. When you get the STD, it turns into this plant.
That's what I'm saying. You could just
Hooker's
do.
lips.
People would be so ashamed of STDs if they just gave them better names. The marketing strategy for STDs was bad.
Like if they had one that's just called, you get one that's just called Courage. Caught some courage over the weekend.
Courage under fire.
Sucks, man. Just have to disclose that to you.
Boy,
Because it burns.
Yeah.
this conversation's stressing me out.
Well, maybe we should go into some ways to reduce that stress, Mace.
Ho ho! Look at that segue. Look
Hello.
at that segue, son. Well, what are we talking about today?
Stress reduction. So, stress is obviously ubiquitous. It's like a.
Ooh, that's
What's that? What does that word mean?
It's
Is that a flower?
Yeah.
it's
It's a
widespread.
ubiquitous plant.
I've got ubiquitous in my nether regions.
Yeah, I picked up some ubiquitous.
From those
Off the street,
I picked up ubiquitous from those hooker lips.
it's laced with something too.
Yeah, what does ubiquitous mean, Jeff?
Well, the non-STD definition is it means it's everywhere, widespread.
That could be an STD.
Yeah. Whoa. All right.
So it actually is an
That
STD.
fits. Yeah.
So stress is, everybody deals with stress, is what you're saying.
Just like STDs.
My bad.
Right,
Well, speak for yourself, Playboy.
Come on. You know what they say? No, I don't.
Yeah, what do they say?
Yeah, you know what they say?
It's horrible.
Fool me once.
Fool me once.
I still got AIDS. I'm just kidding. I'm not.
Stress.
Stress. Back to stress. Okay, so what were you saying, Jeff, before I so rudely interrupted you?
No, just everybody deals with it. And it's kind of this weird idea of like stress reduction. You know, stress, I guess something that I like to talk about with clients is letting them know that stress is actually an adaptive response, and that if not for stress, humans would have died out a long time ago. And so usually I'll go into talking about, you know, our distant ancestors, you know, 200,000 years ago on the, you know, the Serengeti, you know, if they heard like a rustle in the bushes and they didn't feel stress, they just went about their daily business. You know, if the rustle happened to be nothing, they're good to go. If the rustle happened to be a tiger, they're lunch. So
what if it was Russell Westbrook who was in the bushes?
who is 200,000 years ago?
Yeah. Could have been.
Well, do you have your timeline straight? Were there people on the Serengeti 200,000 years ago?
I think that 350,000 years ago is how.
When it was
I'm
founded.
pretty sure I'm right.
There's probably some archaeologists or paleontologists like, God, these guys.
They don't even
You know, if they're
who
not
Russell
after
is.
us for our botany knowledge yet or STD, like they'll get me on the anthropology. Yeah. No, it's but like people by and large developed a stress response, and it's a survival based thing. So again, like we're more likely to attribute the rustle in the bushes to being a negative thing, which is what gets us to, we feel stress, we run, and if we were correct that the threat in the bushes was a predator, we live. If we're wrong that the threat in that the rustle in the bushes is just the wind, we still live. So stress ends up being an adaptive response. And I try to kind of let the clients know that to normalize stress as being something that you're not going to avoid it. It's just your body telling you that something in your outside or inside world, for that matter, is in need of changing or modifying. So it's about adapting to that stress, using it as an indicator.
Yeah, it's functional.
It's functional. Yeah. And for them to look at it that way rather than as an absolute negative. It feels negative, but it's really just telling you that maybe you need to change something.
So your normalization of that is really an attempt to kind of just, I guess, for them to say that, well, everybody deals with this in one way or, and the simplest solution to that is if I change my belief system about what stress actually is, I might not think it's that big of a deal. Whereas if I'm experiencing stress and I've already categorized this in my mind as this is a bad thing, well, if I categorize a bad thing, I'm going to react to it poorly. I'm going to react to it badly.
I want to get rid of it.
Yeah, of course.
Yeah.
Your mind is hardwired to kind of get rid of some of those things. Yeah, it's definitely I think for any of our clients who are one way or another involved in the criminal justice system, whether that's addicted to alcohol or drugs or having sexual behavior problems, I think life can be stressful. And when it comes to something like sexual gratification, mood altering drugs, that certainly can. I mean, I think it's also important to be honest with them and say that can temporarily reduce the level of stress that they experience as a result of like what's going on around them. But likewise, when that effect wears off, I think sometimes even they feel even more stress after that's kind of happened. I mean, do you guys notice that?
Because our problems compound?
Well, I think that at this point you're just treating symptoms, right? I mean, if you think about when I experience stress, I try to look at that myself, and I say, well, I think I feel like it's almost kind of like if it's almost stress or anxiety or whatever, it's like I kind of feel butterflies in my stomach, but they're like butterflies with razor blades, I guess, if I wanted to explain them in a way, because it's not like a butterfly is like I'm going on a roller coaster type thing. It's like I'm worried about something that I don't have a ready solution for, and I don't like feeling that way. Well, if I worry about paying a bill, I pay that bill and then I don't worry.
Right.
There's a functional purpose behind that worry.
Yes.
If I'm stressing for the sake of stressing, I guess the problem with that is I don't get really any resolution. Now if I just treat the symptoms of that, if I get high, my stress is going to go away temporarily, but the problem that led to that stress in the first place still exists. I haven't done anything to solve that problem. So I think they offer temporary relief from symptoms, but it's not treating the problem, which is not an effective way to deal with it.
Exactly. Yeah. And just to expand on your idea of the natural impulse to treat the symptom. So like drugs and pornography are maybe the most obvious things that come up in treatment. But I mean, they're like people use avoidance with stress for a lot of different things. They'll use, I know that I get really hungry when I'm stressed, and I'll put down the worst kinds of foods for me, and it feels really good in the moment. But again, it's just the same thing that drugs provide. It's that temporary release. Various distractions. Again, I'm not saying that distractions don't have their place, but again, it doesn't address the original concern of, okay, well, what's driving this stress? Okay, I have this bill to pay.
Well, is it a distraction, or am I avoiding it? Like, I think there's a difference there. Like, maybe sometimes I need a break, but if I'm just doing things just to avoid it, and like Mace was saying, it's probably just getting worse too. So I look at it like I talk about this in my groups, like going between short-term payoff versus long sustained payoff. Like, I think of, I don't want to pay this bill because I don't have money. That stresses me out, so I don't pay it. But in the long term, I'm stressing more about the bill, and more that I can't pay it, or more that I needed to get my treatment assignment done. So what happened is in the long term, I actually ended up having more stress because of how I handled it in the short term.
Exactly. Yeah, and maybe to add to what you're saying, so if you have a bill to pay and it's stressing you out, and you're saying like the natural negative impulse is to get it off your mind, not pay it, focus on something else, maybe buy something out of the $5 DVD bin, get even more problems. It's like when you're stressed, your decision making goes to shit. And again, I think that just to maybe call back to what I was saying with stress being an adaptive response, a lot of our listeners are already aware of like the fight or flight response. But one thing, the way I explain it to clients is, again, the whole idea of the rustle in the bushes and the tiger and whatever. When that happens, our body reacts to get away from the problem or fight it. And so, our pupils dilate to allow in more sunlight so we can see our surroundings. Our muscles fill with red blood cells and adrenaline so that we can fight and have oxygenated blood to our muscles. These types of things happen to help us fight things off. And so stress back in the day was very much survival based. So either the tiger ate you or it didn't, but things were probably decided in less than a minute. Either you got away or you didn't, and then your body would return to baseline. The stress is no longer there. You're, off you go. Like contemporary stress, we don't have as many life-threatening things. There's not, tigers in the bushes waiting for us, but we have these things like a mortgage or, a probation officer, an 18-month treatment program, these, problems with your spouse, loved ones, that those don't fall into the same category as a tiger trying to eat you, but your body maybe on a lower level will still react to it physiologically the same. So you're getting like a low level fight or flight response. And the problem with that is even though your body is equipped to fight or run, the thinking portion of your brain, the cerebral cortex, is dimmed a bit. And so you're thinking with limbic system, you're thinking with a part of your brain that governs survival and emotions is sandwiched in there somewhere. And so if you're looking for a stress reduction when you're keyed up with the fight or flight response, you're going to go towards the thing that feels good right now a lot of times. And contemporary stress is, like with a tiger, 15 seconds, it's decided either your lunch or you get away. Modern day stress, it's extended over time, months. The bill doesn't go away. You pay it and there it is again next month, that same damn bill, your mortgage, and so we have this, it's not as heightened as a fight or flight response, but it's this low level, constant grinding of dampened physiological stress response, but it doesn't go away. It persists and sticks there. So again, like helping clients see that they're still just reacting and that their decision making goes to crap if they're not addressing the stress. I think it helps them see why they might go towards the instant gratification option rather than the smart option.
Well, it makes your brain it doesn't seem like your brain would work very well if both of those components of your brain were going at full speed at the same time. You know what I mean? Like if a tiger jumps out of the bushes and you try to have a conversation with it to calm it down, like, of course, that's not in our best interest. It doesn't seem to fit with survival. So do you think instead, though, that there certainly are times that it calls for that? I mean, if my life is being threatened, the tiger is a good example because it's an extreme example, but sometimes clients will be stressed out for inordinate reasons. In other words, it's a misinterpretation of the danger of the event. So I'm experiencing stress or anxiety or whatever it is as a result of these things, but I'm doing the result of that is because it's a misinterpretation of what's really going on. Does that make sense?
Absolutely.
Mm-hmm. So I think, the one thing is if I think about the disease model when it comes to medical treatment, and sometimes comparing this to physical health is sometimes helpful when you talk about behavioral health. With physical health, if I was only treating symptoms, we would be screwed. So if I went into a doctor with a broken arm and I said, "Hey doc, I got a broken arm," and he said, "All right," and he gave me some pain meds. Okay, well, my pain's going to go away, but then, what about my arm, right? Well, of course, doctors don't do that, but if they were only chasing symptoms, they would never resolve the underlying issue. So that arm needs to be set. It needs to get a cast on it. I probably need to get some antibiotics and some pain meds to kind of, take care of the symptoms. So symptom management isn't awful, especially because my concern is on that, if what we're saying is true, the clients that we work with, if I'm experiencing stress, I'm also not thinking clearly, but we're asking them to do two things at the same time. So wouldn't a management of those symptoms initially be worthwhile and then go into, well, I'm going to think this through and come up with a plausible solution to curb the underlying problem?
Yeah, absolutely.
So how do you do that without being unhealthy, though? Like, so if drugs take care of symptoms temporarily, eating unhealthy foods take care of symptoms temporarily, how do we deal with that in a way that doesn't require unhealthy habits to then relieve symptoms?
I think CBISO, again, CBISO is cognitive behavioral interventions for sex offenders. It's
cognitive behavioral interventions in general, right?
Yeah, any kind of CBT is going to help. There's specific skills that are taught as part of the curriculum that we go through that maybe helps you focus in on the source of your stress, helps you understand maybe the exact emotion that you're feeling. And then sort of like once you've put a label on it and developed an understanding about it, there's a few different stress-based or stress reduction cure-alls, coping skills, things that take the intensity down a little bit, offered up in the curriculum. And then there's obviously some that I'm sure each of us have our own examples of things that we teach clients or even do ourselves to deal with that stress. But I do think step number one, if our goal is to cope with the symptom temporarily, to take it down a few notches, the intensity, and then tackle the problem leading to the stress. If we're going to agree that that's the best approach, which I do, identifying the source of the stress, I think is kind of step number one. I mean, and again, if we want to jump into what coping skills we use, is that what you want to do? Should we just go into how we teach clients to cope with stress, the different tactics, different ideas?
I guess it would depend on what the stress is, because the one thing is I think it's important for the clients to understand, anybody understand the difference between stress and stressors, right? So like a stressor is just something in the world that makes a demand on a person. Okay, so in other words, a stressor is just an event, a person, a law, a rule, a request that requires me to react to it in one way or another, right? And if you think about stressors, there's basically three different types. So frustrations, pressures, and conflicts is typically how they get broken down. Okay, so frustrations, pressures, and conflicts. So stress a stressor isn't the same thing as stress. Stress is an internal reaction to the demand of the stressor. So, for example, if a person is expected to be at a meeting at a very specific time, that expectation is a stressor, right? So there's pressure on me to be able to attend that. Well, if the person feels a need to meet the demand, he or she will feel a little bit of stress, because if I'm supposed to be at that meeting on time, I feel pressure. I should try to make it there on time, right? Not every stressor, however, will cause the same level of stress in every person. So for some people, they get really frustrated with it always makes me laugh. You ever meet those dudes that are like, you're on time when you're 10 minutes early? And I'm like, well, okay, so do you want me to be here 10 minutes early? No, I want you to be here at 5, which means you need to be here at 4:50. I'm like, do you want me to be here at 4:50? Well, then you need to be here at 4:40. Like, that's like if you set your. I love like how people will do that. Like you set your clock ahead 15 minutes, and somehow you think that's gonna. But you know that you did that.
Oh yeah,
so it's like,
no,
it's 15 minminutes fast. Don't worry about it. Well, wait, if you know, then why have you done that, you dummy? So those are situations I think that everybody. That just gives the idea that everybody interprets something like time and time management and the pressure associated with that differently. And the question then is okay, so can I first dial in of whether or not this person's interpreting this incorrectly? And if they are, that's when we would need to invoke some sort of behavioral or coping technique, because what we don't, again, we're not just treating symptoms, we just want their perception of that event to be accurate.
Right.
An accurate, ordinate response, and then they'll respond to it accordingly. So we don't want to get rid of it. I don't want people to miss appointments by coping. I want them to make their appointments. I just want their interpretation of the pressure associated with having to be to a meeting appropriate for the situation.
And I think that is achieved, if I'm following you, by helping them turn down the volume on how intense they're experiencing the stress.
Sure.
They're going to be more rational if they can dial it from an 8 down to a 3 through any number of stress reduction techniques, and then proceeding to solve the problem at a 3. You're going to be more rational than when you're keyed up at an 8.
Mm-hmm.
Yeah, absolutely. So I guess we could. It's like one of those things. Do we turn this into the type of podcast where we just name things we have clients do? I mean, we could. I mean, I'm always a big fan of teaching them how to structure and organize their schedule.
Mm-hmm.
You know,
why would you start there though? Like instead of saying, okay, we can talk about an emotional regulation technique and the appropriate way to do that. We can give them a simple one, which I think is worthwhile. Mm. But that's actually an excellent starting point. I mean, for you guys, what a simple conversation to have is, do you have a structured schedule and are you following it? I mean, why start there versus anywhere else?
Well, I think it minimizes chaos. It provides order.
Does that keep dropping down? That might.
Yeah.
All right, I'll fix it.
No, that's fine. I can hold it like this. But
Jeff sucks at his microphones. He always has, always will.
What am I doing wrong here? I'm just sitting here.
Well,
I'm innocent.
First and foremost, you're a ginger.
Mics don't like the ginge.
Okay,
Oh,
are we
thanks.
fixed
Yeah.
now? All right.
Yeah, just it tones down the chaos and provides order. And I think that if things are a little more predictable, again, that's what I think a schedule does, is it makes things more predictable, and it shows you priorities. It shows you timelines if things are due. And again, keeps you from that obnoxious deal to where like, you have some task to accomplish, but you can't quite remember what it is. So again, I really try to get clients that are allowed to have a smartphone, just, get them up and going with the whole Google Calendar idea and really getting them to structure things. And it seems the more they structure, the more they get done. But again, I think the orderliness and lack of chaos and predictability, just from getting used to structuring a schedule, makes their overall ability to cope with stress a little more enhanced.
Well, yeah, because think of the way that life works. It's not like as you turn into an adult, you have no schedule, just nothing, and everything's handed to you, and they say, okay, organize it the best. No, you set it up for how it works at the time, and then things fall off, things get added, and usually you start to add things just where it fits at the time, but then it just gets out of control. So sometimes I like that, because it's, if I'm recognizing I'm stressed, what do I do first off just to organize everything? That might by itself make things a lot easier. So maybe I look at it as, maybe I don't have one big glaring thing that's a stress. Maybe it's just a combination of a bunch of little things that are just kind of off or harder to do. So maybe if I look at my schedule and I can streamline things, okay, there's a little breathing room, just making things easier on myself.
Exactly. And I think it's the same concept, but getting them to do the same thing around the house, right? I know that when I come home from work and, there's not a pile of dishes in the sink and there's not crap everywhere, I naturally just feel a little bit better. And I know that I'm not alone in that. When I've talked about this, lots of people seem to feel better just overall in dealing with stress, whatever it may be, if their living environment is clean. So it's structure and order in keeping time and management of schedule, and also keeping a clean living environment that's ordered, again, structure, just less chaos, more predictability, less stress overall, as far as like a starting point.
Well, then also, so let's say my goal is, okay, I want to start keeping my house cleaner. Am I making it so it's easier due to my schedule, whatever, my habits, easy as possible to keep the house clean? Like, what if I look at my schedule and the only time I have to clean is at the end of a 16-hour shift every day? Like, what are the odds I'm going to come home and clean? Like, probably not great. Yeah, so I maybe need to rework some things or change up my habits as far as maybe cleaning the dishes as I use them, or maybe it's over the weekend I get caught up. But I think it's also, what kind of structure do I set up? What kind of system do I set up that makes this goal or this habit most likely, like, that I'll follow through with it, as opposed to trying to cram it in somewhere where I just know at that, like right now as I'm planning it, that sounds awesome, but at the end of the day when I'm done, it's like, I'm not going to do it, which is okay to admit, but it's just saying, for me, it just doesn't work in this spot. I've got to find a different way to set it up, or I've got to find a different place or time to do this when I know I'm going to be more likely to follow through.
That's huge. But what you just said, that finding the time when they're most likely to do a given task. I'll give that advice when people are asking me for like exercise advice, and like when is the best time of day to work out? And people will say, well, in the morning because your testosterone levels are higher, or in the evening because of this. It's like, well, whenever you're most likely to do it, and that's where structuring and scheduling and to the best of your ability around when you're most motivated, but by and large, it's like, when are you most likely to do it? So if we're doing, and I don't think people put a lot of thought into, well, when am I going to do the dishes? Because it's like one of those things that's pretty low down the priority list.
It's easy to put off.
It's easy to put off. But if you can take a page out of your book with what you're saying, is like, okay, well, you know that you're going to feel better when the dishes aren't piling high in the sink. When are you most likely and most motivated to actually put it away? And if they can put just a little bit of thought to that, just enough to be able to come up with a time and date, and that they can stick to, again, it does help out with the bigger issues, the bigger overall stressors.
Well, and think about what you're doing there. That's a pretty elegant solution to what we're saying, because you're scheduling when you're going to experience the pressure to resolve that task or whatever it is. So if it's the dishes, I'm not foregoing it forever or just saying, I'm going to get around to it. I've actually said, yeah, this is something I deserve to feel a little bit of pressure to do, but I'm not going to let myself experience pressure to do this now. I'm going to experience the pressure to do this later on. So we know that, stress can come from pressures from that, force any of us to achieve specific goals by speeding up, working harder, changing the way we do something. We all know that's exactly what we're saying here. And people who are in treatment, I think they don't only have like external pressures from like family and friends to get better quickly, because they want them back to square, get out of prison, get out of programming, get, this, that, and, but they also receive pressure from us, from their therapists. Like, hey, you need to be reducing risk. You need to be demonstrating clean time. You need to demonstrate clean UAs. And so I think that anytime that we can organize that pressure, it's better for them. So if I have a UA, that I have to go to, okay, when am I doing that UA? When's the best time to do that? Well, I really worry about that when I get off work because I come there and I just don't have enough time to get, okay, is that necessary that you do it at that time, or can we organize that at a different time for you to go and submit that UA? Is there a better time to do that? It is pressure, for sure. Can you organize that pressure that's more amenable so you can resolve that pressure and not let it kind of consume you? Because if it comes to the point where, I can't even resolve it, that's where we have a problem. So I think scheduling is a really elegant and simple solution. Sometimes easier said than done because sometimes it's so overwhelming that people can't even get that taken care of. But it seems like a pretty simple solution if you just commit to it in the first place.
Awesome. What do you do?
And that I think informing clients pressure can be good or bad. It's always making me think like peer pressure. When I think about peer pressure, it's not really, my friends for the most part might say, hey, come over. And if I'm telling I'm doing good, I pretty well trust my friends that they say, they're not going to offer me any drugs or anything. But if I'm there, I'm watching them do it, then I'm still pressuring myself to do some of these things. So again, am I mismanaging my time such that I'm experiencing more pressure or less pressure is really what I want to know. Okay. So that because that's going to cause a lot of those situations where I'm going to experience that. So I think organization of schedules, like Justin was saying, I'm not going to not do the dishes. I'm just going to do the dishes on Friday at 4 p.m. That's when I'm going to do the dishes. That's when I'm going to worry about it.
So when you say mismanaging your time, is it kind of the idea there? You mentioned, if I'm around friends that are using, the longer I'm around them, that's more time in front of the stressor, more time with the stressor, having a chance to break me down, whatever it is. And so, finding ways to, so I guess if you're talking about managing your time.
I guess I didn't articulate that very well. I'm saying that, okay, if I go to my friend's house and I'm watching them get high or get loaded, maybe they want to invite me to do that, or maybe I'm just pressuring myself while I'm sitting there, right? That's pressure. But I can also get pressure from people just encouraging me to do good things. So if it's my wife encouraging me to do, to do the dishes, or it's pressure from, my boyfriend to mow the lawn, or whatever it is, whoever I'm talking about, they're pressuring me. Well, those aren't bad things. They're still pressure, though, right? They're still pressuring me to do those things. One situation, though, if I get high, that's likely to cause more stress over time in the future, right? While the other, if it means I'm going to do the dishes, or maybe I have a sober friend who's encouraging me to go to a meeting, or, let's carpool to therapy or whatever, that will probably reduce stress in the end. So when I'm saying managing time, look, pressure is inevitable. You're going to experience it when you're in treatment no matter what. The question is, can I alter my schedule such that the pressure that I'm feeling is recovery-oriented pressure to go to a session, pressure to go to meeting, pressure to, those are good pressure. Of course you feel pressure. Well, everybody feels that. But can I gear that in a way that's more amenable to my treatment, that's not going to cause more stress down the line?
Yeah, that's awesome.
So I think that conversation is good with them. The other thing is I think giving them a pretty good understanding of how stress affects the brain overall too. Like because stress is a huge player when it comes to addiction and specifically when it comes to relapse and really any type of compulsive behavioral problems. So if I have that compulsive side to me, that's just something that I need to be aware of, because so the stress the stress, it's like it's called corticotropin releasing factor. You guys ever say that?
Corticotropin.
Is that a band from the
CRF?
90s?
Yeah, it's
They opened up for Crystal Method.
Yeah.
yeah, they open for Crystal Method. And then Crystal Method comes out and plays all Tiesto songs.
Yeah.
So whenever we experience chronic or severe stress, that CRF is released at a higher rate. And what ends up happening is that it actually starts to make our brain really unable to interpret pleasure at that point. You guys, so there's a concept, there's a kind of a type of thing called anhedonia, which is like the absence of pleasure. Some people call it pleasure deafness. And the person is just no longer able to derive normal pleasure from things that have been pleasurable in the past. Now, this is...
And what's it from?
Well, so I want to be clear. This is only when I'm using maybe an illicit substance or sexual gratification, like if you think about illegal drugs are easy to understand, but if you think about sex, right, or even masturbation for that matter, like what's the purpose of sex between a man and a husband and wife? What's the purpose of sex?
I mean, I guess you could say procreation. You could say enhancing the relationship, pleasure.
Okay, so what I didn't hear you say though was managing stress.
Oh, right.
Right. So if it's we're doing this as an expression of our love for one another, we're doing this as an enhancement of the relationship, and we're doing this just for pleasure. Okay, then you're doing it right. If you think about the use of masturbation, why do people masturbate? Well, if the purpose of masturbation is just deriving pleasure from yourself, have at it. You're doing it correctly. If you're using that as a method of coping with stress, I'm going to say you're doing it wrong.
Dang it.
So, because basically what you're teaching your brain is that when I'm stressed, then I'm going to manipulate brain chemistry to release dopamine, but it's done inappropriately. It's done at a time when dopamine would not normally be released.
Kind of like misassigning it.
Right.
Yeah.
So if I go to so if I go
sense.
to right, so if I go to Disneyland, you should experience dopamine surges. If I get a job promotion, you should experience dopamine surges. If my kids do well in school, yep, you should experience dopamine surges. Those are normal, right? But so our ability to experience that pleasure relies on what's called a hedonic set point. So you guys know another set point, easy to understand, that is not so favorable is like 98.6, right? That's not a radio station, but that's our normal body temperature, right? 98.6 degrees. Okay, so
what about 98 degrees?
Yeah, they're pretty good.
So
Yeah,
98
that's the
degrees.
sequel band.
If you listen to 98 degrees, 98.6 is the sequel. It's the one-off band.
Just 0.6, just the stupidest ass name.
I'd probably go see them though.
Yeah, I would. Oh, yeah, 98 degrees is the worst band ever. So if my temperature goes to 103 degrees, what do we call that?
Fever.
But what's that fever in response to?
Cowbell.
A cowbell. Yeah.
Trying to fight off something.
Right.
Yeah.
Right. So something has come in there and said, okay, your immune system response is out of whack, so we're going to increase this fever, and you notice it. I mean, you can totally feel the difference if you have a fever. We feel like crap. We can't even sometimes even operate very well. We got to stay home. All the rest of it, right? So we have a pleasure threshold, and that's kind of our hedonic set point. And hedonic hedonism, you kind of get the idea. Our ability to experience pleasure requires that the dopamine surge that we have goes beyond that pleasure threshold. Well, the problem goes like this. So every time that I'm doing that in an inappropriate response, in other words, I'm experiencing stress. So my brain is releasing this CRF thing, which is kind of saying, okay, hey, something's going wrong. This is something you need to pay attention to. Resolve this. And instead, I release dopamine as a result of that. But I'm not doing it authentically. I'm manipulating brain chemistry. Well, what that does is your brain's like, wait a minute, we can't operate like that, because if we operated like that, when would we know that something's stressful? Going back to your thing, when would we know that this is a survival component that we really need to resolve in our life? So then your brain resets that set point. It says, okay, well, this isn't right. I got to reset this because this is fabricated dopamine levels. I got to
resets it higher then.
Resets it higher.
Yeah.
And it requires more drugs or more sexual stimulation to reach that threshold. So so every time I do that, I'm increasing that, and I'm requiring riskier and riskier behaviors over time, which then, so things like Disneyland, job promotion, kids doing well, those no longer apply. I don't experience pleasure for those any longer, and I have to engage in some, way outlandish,
up.
Way outlandish behavior in order to be able to do that. So those old pleasures don't show up. So I think that when you're teaching a client, that kind of goes back to the idea. When I'm dealing with stress, the answer to the original question was, well, do I need to manage those symptoms somewhat? Yeah, you do, but not by trying to increase dopamine. So it's not by me going and getting, Five Guys and dealing with it that way, because Five Guys feels awesome in my mouth, tastes awesome, and it releases dopamine for sure.
Well,
and come on now,
you're talking about the burger restaurant, right?
You say Five Guys feels awesome in my mouth.
Yeah,
just clarify. Right?
Yeah.
Yes, Five Guys burgers
and fries.
Not
burgers.
Five dudes. Yeah, five dudes behind the
five
dumpster.
Dudes feel good in your mouth, bro.
That's a good point.
Damn, I didn't even think
Yeah. So I'm not really dealing with stress appropriately. So yes, stress is going to be uncomfortable. I think getting to the point where I'm going to accept that, and then cognitive behavioral therapy is tough because it's kind of a crap in and crap out system. If I don't relieve the symptoms that come from stress, then the thoughts that go into that system are going to be crap.
Oh yeah.
Then the behaviors that are going to come out of that are crap too. So if I have such an emotional attachment to the event, or a stressful response to the event, then yes, you do need to calm yourself down so you can think clearly to resolve this. But when you think about emotional regulation techniques, they're not nearly as sexy as Five Guys in my mouth, or
well, and they don't work right away.
Yeah,
right.
And I would never tell a client, "Yep, you're going to feel good." If you think about it on the spectrum of, I feel shitty, I use cocaine, I feel good. That's a guarantee every time. Mm-hmm. Our techniques are, I feel shitty. You use an emotional regulation technique is, I feel a little less shitty. That's about as good as it's going to get, right?
Mm-hmm.
That's about as good as it's going to get, to the degree that you can think a little bit better and then resolve it. And that's our goal.
I think it helps them when you actually do explain it that way. Because what happens is if a client expects the coping technique to match the bump of coke that they did, they're going to get disappointed in it and throw it out pretty quick.
Mm-hmm.
And when you're like, you know what, this, Mace, I actually think I got this from you when you were talking about the behavior chain a long time ago.
I guarantee it.
It said that, doing the behavior chain, it does a bunch of things, but in terms of helping deal with stress, it won't make you feel good the first one you do, the first 5 you do, the first 10 you do. Maybe after 3 months of continued practice and constantly, being vigilant about these things, it might start to make a difference. And in the long term, it'll make a profound difference. But it takes having the discipline to stick with it and to do it over time, knowing that you're not going to get that big bump in pleasure that you would off a maladaptive coping.
Right. Exactly. So when it comes to like emotional regulation, so if I, again, this is not a technique that if you're interpreting a stressor and experiencing stress in a regular way, in other words, you just solve the problem, then that's a signal that you ought not use any of these skills. You don't need to use any of these skills. The question is, and this is easy to pay attention to, is ask yourself the question is, when I'm stressed out and when I'm dealing with whatever emotions attached to that stress, do I usually make poor decisions? Okay. Well, if that's the case, then you need to use an emotional regulation technique. So kind of the foundation of that is we just say, first and foremost, we want you to pay attention to your emotions. In other words, you just have emotional awareness. You're just acknowledging that you are experiencing an emotion, right? And if you think about that, human beings are really, I think we're fortunate enough to experience a range of emotions, and categorizing it is really important. So if I experience an emotion, just accept the fact that you're experiencing an emotion. But you know that stupid movie, The Secret? It's like the most awful shit. Dude, I hate if you ever talk to anybody about The Secret, and you're like, well, I could imagine $1 million being in my account, and it'll never be there. And like, well, see, because you just said that. That's I'm like, okay, so that's like the same argument for like God. Like if I say, I quit. Well, you're not seeing the signs, bro. I'm like, okay. Anyway, there was some guy along the way that was in that show that they did say one thing that I really like, that emotions are just like alarm bells to pay attention. They're just saying, hey, dummy, something important is happening. That's it, right? Compare that to like a deer, right? A deer has one emotion, fear, and that's all they operate on, which is essential for their survival. So deer, if you look at deer, they're stressed all the time.
That's true.
Like if we were a bunch of deer in a field, it'd be like, "Did you hear that? What do you think that was? You think it was like everything is we're gonna die,
threat,
and naturally because they're prey, right? So what I would say is emotions, regardless of which emotion it is, happiness or excitement or any of those things which we kind of categorize as good, those are necessary for our survival as well. Those are 100% necessary for our survival because it's saying, pay attention, dummy. This is important. That's all it's saying, right? So the second thing is we want to identify our emotions, which is saying, what emotion is it? And I don't know, this always turns into a weird conversation. I mean, I feel like I don't know, like clients are like, so do I need a thesaurus when I bust this out to have that? I'm like, I don't know.
As far as identifying the emotion?
Yeah, like I'm wondering strategically, I think as a clinician, I run into the barrier of, well, how do I appropriately label this emotion? And I have some thoughts about that, but I'm wondering how you guys deal with that. So if a client says, well, I don't know what it is. I don't even know what perplexed means, dude. So
I don't go that route. I say sad, mad, glad, scared, or excited. And then like, well, if they can throw out some variation in that sad, mad, glad, scared, excited, that then we can start to narrow down more specific complex emotions like perplexed or embarrassed or whatever those are. So I keep it real simple.
Yeah, I think the simplest one, the version I've thought about it was, I think, okay, so I think like, ballparks and universes, right? If I think about like, okay, I'm angry, right? But dealing with anger is way different than dealing with enraged. If I was enraged, there's a clear difference there.
Gotcha.
And if I'm angry, well, I can also be frustrated. But frustrated isn't the same as anger, and how I would deal with being frustrated would be different. Well, I can be frustrated, but I can also be irritated. And irritated, I wouldn't deal with that the same way that I deal with that. But I can be irritated, but I can also be annoyed. And how I deal with being annoyed would be different than being irritated. So there's a spectrum there. Coming up with the right word doesn't necessarily require that. I say the spectrum says that these emotions are in the same ballpark, right? We don't want to say they're not in the same universe, like happy and angry. Those are totally different emotions, right? We know that those are very different emotions. And not categorize them as good or bad. They just are. But anger, I think, okay, then label it as angry. What I want to know is put that on a scale. Put that on a scale from 0 to 100, and ask yourself what your threshold is. And say, and I know nobody has this, and nobody has a dial in their brain. I'm saying pick a number and say 8. If 0 is, and you got to think about it like this: 0 is no anger whatsoever. 100 is the most anger I've ever even imagined. In other words, I've never even been that angry. At what point are you breaking shit, punching somebody in the face, saying something that you're going to regret?
Don't regret it.
So if I say 70 is my threshold.
70 is your threshold. Then an emotional regulation skill, the objective of that is to get you to a 65.
Gotcha.
That's it. In other words, you're still going to be angry. You're just going to be angry to the point where you're going to do something dumb. And then you can think through this and solve the problem. So I think that identifying your emotions is crucial because it then determines how I'm going to do it. So then the next step is managing your emotions. In other words, how do I cope? But you can't get to 3 till you've gone through 2. So I have to first say what emotion is it before I pick which emotional regulation strategy I'm going to use. But That's a pretty simple linear process there.
So you get the client to say, I'm feeling anger. I know that for me, it's dangerous when I hit 70%. Right now, I'm feeling about 70%. Then that client's gone through the process of identifying their emotions, scaling it so they can get an idea of where it is. Getting an idea of where it is tells them if they're potentially in danger of acting in a way they're going to regret later. And then it's going into the ways of coping with it to dampen the intensity of the symptom. And once the intensity of the symptom is dampened through a coping skill, then you can look towards alleviating whatever the stressor is or problem solving it.
Correct.
Well, yeah, because think of that. Let's say I have anxiety or a panic attack at a 10, like the worst I've ever had, and then someone just says, well, let's just sit down and look at your schedule and redo this right now. It's not going to go well. So it might be your anxiety is so high, we got to calm you down first and then go into problem solving.
Mm-hmm.
Yeah.
Right. Well, and I think when you go into using whatever technique it is, I think it's important to have intent of, it's not going to have the absence of this. It's going to make it a little less shitty. So strategies that we kind of talk to them about, and these are simple ones that anybody listening to this can use, and you can use it with your clients as well. So one we talk about is counting backwards, right? So that's a really simple technique. It just focuses your mind away from risky thoughts. Now, there's a method to this. So one of the things we say is choose a number that's above 20 and count slowly backwards from there. And then you stop counting once you feel more relaxed. And one of the things I tell my clients to almost every time is don't count backwards from 20 down to 1. Count backwards in threes. Mm-hmm. And the way I sell this to them is I say, okay, think about when you were a child, or if you've talked to a child recently, and how stoked they were when they learned to count to 10, right? Like you can count to 10 mindlessly. It's like you're not even using very many brain cells to do that. Now, if you force yourself to say, okay, I'm going to choose the number 24 and I'm going to count backwards in intervals of 3, then what I'm requiring more effort and more focus on that. I'm not really doing anything magical. I'm just creating mental distance away from the stressor and me doing the counting. And that's it. If you get down to 0, that stress going to be away? Of course not. Like it's going to be to the point where I can think through this a little bit easier. And that seems to have a pretty good effect with the clients. I don't know what your guys' experience with counting is.
I pretty well deliver the exact same concept the same way. And I think it's worthwhile going through the effort of explaining all of that because it sounds such like a Mickey Mouse intervention, like count backwards. That's what I'm paying you for, bro. Like, it's like, yes, and here's why. And so I think explaining the reason behind it sells that a little bit better to the client to make it make sense. And it does. And same thing with deep breathing. You know, it's like, it sounds such like an elementary coping skill, but when you can talk about biofeedback and, you know, when you're dealing with a fight or flight response and you take deep breaths, what's actually happening in the brain as you're taking the deep breaths. Like, I think providing that education to the clients gets them to see why we're having them count backwards by 3s with a number higher than 20, or why we're asking them to take deep breaths and, maybe even being mindful of the breath going into the nose, feeling it in your lungs, out through the mouth. You explain the reason behind it. Seems like there's better buy-in.
Right. I think so too. I mean, and I don't know. When you get into those self-control strategies, though, the thing is you don't want to railroad yourself only into one, which is kind of why we want to say, well, let's give you a couple. Because, look, counting isn't the solution. It is a solution, right? So another one I think that we introduced to them is the idea of like having pleasant imagery or visualization, right? Like I can say honestly, this has never been one that works very well for me. I have a hard time with it, and it seems a little hokey to me. But it's pretty well encapsulated in, or I guess portrayed, I should say, in Fight Club. So where Edward Norton was experiencing really high levels of pain or whatever, and he would, go to his, what was it, a cave with a penguin?
Yeah.
Right. Or Happy Gilmore.
Happy Gilmore.
Where he goes-
That's your happy
Another
place.
penguin.
Yeah.
where he goes to his happy place. Now, one
Chubs.
so
He's got
so
chubs.
even though those funny things have kind of made their way into comedies and pop culture or whatever, those are really, if you can mentally remove yourself from the current situation or mood temporarily, that's really what we're going to. The one thing I would say is make sure that you're imagining like a relaxing place. That's kind of why remember when Happy Gilmore was listening to that, and then Shooter comes in and starts
Like mailing his wife.
Taking out this grandma.
yeah. Obviously, that made him even more frustrated and more pissed off. So I would say whatever scene you choose, make sure it doesn't include drugs and alcohol, violence, or any type of sexual behavior. So I think there was like a midget on a unicycle carrying like a couple of like
Yeah.
or a little person, I should say. Sorry.
Pictures of beer, I think.
Yeah, right.
Pictures of beer.
Right.
Yeah.
Maybe not. And the thing is pay very particular attention. One thing I might ask clients is, of course, close your eyes. What do you see? What do you hear? What do you feel? What do you smell? What do you taste? And sometimes I'll add a variation to that. I'll ask clients if I'm doing a in-session experience, I'll say, tell me 5 things you can see. Tell me 4 things you can hear. Tell me 3 things you can feel. Tell me 2 things you can smell. Tell me 1 thing you can taste. And
It's a lot of mental energy to
if you
think
go
about
through
those things.
all that and you're still wrapped up in this issue as much as you were before, man, like then there's something wrong there. You're doing it wrong, obviously. But
briefly run that down again, because there's a lot of value in what you're talking about as far as tuning into the senses and doing those grounding techniques. Like,
well, so if I just ask them to close their eyes and imagine a peaceful scene, and I would just encourage them, okay, make sure that scene doesn't include any drugs or alcohol or violence or sexual behavior, and I would ask them to describe the scene to me. And then after that, I would say, so I want you to kind of identify all the senses that you experience there. So what are, and on a base level, I might say, what do you see? What do you hear? What do you feel? What do you smell? What do you taste? If I feel like we need to upgrade that, I would add into there, what are 5 things you can see? What are 4 things you can hear? What are 3 things? And so on and so forth. Because taste is a 1, so you keep that at 1. And smell, I keep that at 2, because the other ones are a little bit more ubiquitous, you might say. So that's that 5, 4, 3, 2, 1 type example. If you can remember that as a clinician, then you can do that technique.
Awesome.
You can talk them through that. And remember, it's not going to be the solution. It will get them to a less shitty state of mind. That's about it. But again, that creates barriers, because I mean, if you're on the assembly line at like, I don't know, some warehouse or something like that, can you just bust out in your pleasant imagery and be going through that?
Well, that's why you want to
be
hit them
harder.
with a few different coping skills that they can pick and choose based on the situation.
Right.
One of the ones that is super effective, if I can actually talk the clients into doing it, is like 30 seconds, balls to the wall, physical exertion. They'll be feeling profoundly different after 30 seconds if they're just doing like as many push-ups or burpees as they could possibly do in 30 seconds.
Yeah. Or punching themselves in the balls.
That one is a really good distraction.
Seems like that might add more stress.
Oh yeah, don't do that one. I was testing you guys. That would obviously add more stress.
Everyone passed.
I have a hard time talking clients into that one because it sounds so meatheadish, but it works.
Well, and 2, I think they almost always bring up the limitations of that. I don't disagree. I think that as a distraction, I love that. I love that example. But
Hard to pull off on the fact.
What do you? So I'm at a job interview and I just bust out push-ups. Come on, dude. I'm like, okay, fair enough. So yeah, look, the name of the game here is I need to have multiple different techniques, right? Multiple different techniques. I mean, one is simple that people forget is just self-talk, right?
Yeah, well, I was just going to say that's usually one of the first ones I start with clients. Obviously, when we get past coping with it, I usually frame it to them as this: how is it actually a good thing that you're this stressed out about it? Why is it good that you're stressed about this? Most of the time on their own, they'll start, well, yeah, it's going to help me focus on making more money so I can get into my sessions. It's going to help me focus on, because I know for me, I've had to use that. Like, why is it good that you're anxious right now? Like,
how do you answer that?
What?
Like when you're asking yourself that, I mean, is it, like, are you asking yourself that as just like a reflection on it, or is it like you're trying to get them to point out to themselves that they don't have a rational reason to be stressed? Like, what are you trying to do?
So look at it this way, like kind of similar to Mace's analogy earlier. Like when I talk about emotions, specifically stress or anxiety, I say think of like a check engine light on a car. Right now, you're getting a check engine light and you're treating it like, oh, I don't like that light. I got to put tape over that or just ignore it. But you're not addressing what's causing that light.
Awesome.
So in a way, like if you feel anxious about you're falling behind at work or you're stressed out because you've been avoiding your spouse or whatever and it's causing problems in the relationship, don't you think that's good that you don't feel good about that? So this is kind of nudging you to say, yeah, something's off. I got to fix it. Because I think with that, especially stress or anxiety, there's that feeling like Mace was saying, pressure. So if I feel all this pressure closing in and it just feels worse and worse, yeah, I will want to get rid of that. But if I can shift my thinking, I feel more empowered about it, actually. So I feel less claustrophobic. I feel less trapped, which enables me to do something about it. Because just like we were saying, it's ultra functional. If I wasn't stressed about some things, it'd be easy just to let everything fall by the wayside and everything would get out of hand. But I wouldn't care. That'd be the problem. If I never felt stressed, I don't care if my bills are all unpaid. I don't care if I get kicked out of my house. You should be stressed about that.
So the stress that they're experiencing is a good indicator that they give a shit about this thing.
Yeah.
Okay, yeah. I mean, except for when that check engine light is that O2 sensor thing. Like,
oh my God, dude.
That's the worst.
You take it, and then of course your mechanic. I don't even worry about it. Like, well, wait,
it won't affect it. Well, I got to get it registered. He's all, yeah, well, just pay me.
Well, did you see the Avengers or?
Well, I think just like we were talking about, why that gets to be so hard is because if we go back to quote unquote caveman times, yeah, the stress would be something's going to kill me, or I haven't eaten like a handful of things. Where now, who knows what is stressing you? I think that's what feels overwhelming is when you feel stressed. Like, man, why am I so stressed? It's not always obvious. It's usually like an inventory of, like, I know for me when I get really overwhelmed and I stop and take a look, it's usually a bunch of things are like a little out of whack. Like not one big thing, but it's piling up in the back of my head. Though I'm definitely feeling it, but it's not obvious. Well, I can feel like, well, everything actually feels all right when I really stop and look. No, everything's not all right. Nothing's glaringly bad, but there's just a bunch of things that are a little off, and they add up.
Yeah. So in other words, the stress or the check engine light that you experience is an indication. Like, well, yeah, have some self-talk prepared for that. I mean, if the self-talk is as simple as this is important, I need to pay attention to this. Universally, that would apply, right?
Yeah.
I mean, you can't find. I mean, we're not talking about like a positive affirmation, like that's good.
It'll be okay.
Yeah. It might.
Well, maybe it won't if you don't do anything about it.
Well, right. Like the only thing I have with that is, well, what about legitimate situations that actually do suck? Like, so I think that
just good vibes only, bro.
Well, I think if your self-talk is not generic but just accurate to the degree that that this is important. I need to pay attention to this. That's at least going to go down a pathway. I mean, whatever you adapt it from there.
Well, that's at least more solution based.
It's
though.
Practical.
Yeah,
right.
I can use this as opposed to, oh, I'm stressed. I got to get rid of it. Well, I'm stuck in that, and because there's, like you said, there's always going to be stress. So if I'm just in the habit of escaping it, yeah, that's not going to go well. And I'm not going to feel in control of my situation.
Well, the self-talk, I think you always got to be cautious with, because it's not like the opposite. I mean, so what's your self-talk? I mean, so if you're jonesing for some coke, you're like, I don't like cocaine. Like, what?
Of course you do. Yeah,
you do.
If you find a girl attractive, man, she's hot. She's ugly. Like, no, that's not. It's not the opposite. It's more. It's kind of. I've always said, like, well, yeah, I think acknowledge the fact that you're experiencing those thoughts, but include like almost like a but and. Well, yeah, she's hot, but if I pursue that, then it could cause a lot of problems, and I don't want to ruin my current relationship. Like, see what I'm saying? Like, you don't need to exclude the risky thought that you had in the first place. Yeah, some coke could be really nice right now, but I've got 170 clean days, and I don't want to risk my sobriety. You can include it. It's all you can just. I think the self-talk statements, when you come up with those kind of replacement thinking, don't just think the opposite. Turn that frown upside down.
Oh, dude, I can't stand that. Well, especially when you're the one in that mood and someone's like if you're freaking out about someone having a panic attack, like, just don't worry. You're like, oh, I never even thought of that. Thank you so much.
Or like someone gets broken up with, like, there's more fish in the sea.
Oh, that's the worst. Time heals all wounds. So just sit there and be miserable till all of a sudden you're fine.
When in Rome.
When in Rome, there's other fish.
When in Rome, you'll get a bird in the hand and two in the bush.
Yeah.
For some reason, I do feel better now. Actually, that
Make you
helps.
laugh a little. One of the first things we do in this curriculum is we have the clients identify what their values are, and we have them rank them. They come up with their top 10 values. And there's more to the assignment, but by and large, the idea is that if they have an idea of what their values are, their decision making can kind of be hinged off of that. And so with you see the hot girl at the gym, and maybe you've got you actually value the relationship you have with your wife, or that. So again, it's not that she's not hot, because that doesn't make sense. It's inaccurate. Yes, she is hot. It's that you're remembering what your true value is, and that can kind of help you be more realistic with it. More
for sure.
Practical with what your self-talk is.
Well, I think that is one of the biggest parts of that. So let's go back to the Coke analogy. Would that be fun right now? Yeah, that would. But what would not be fun? Failing my UA and going to jail or going back to prison and not having any fun. So that's what I like about this, especially the CBISO program, is it's okay to be honest about that stuff. And usually when I'm running my groups and we're starting out in the first couple modules, I don't know if you guys have noticed this, so we get around to the behavior chain. So we're breaking down my thoughts, my feelings, my actions, and then positive and negative consequences of those actions. So let's say I was doing that one with their group, and I say, okay, what's the positive consequence to doing cocaine? Almost no one will say anything. Right. They're like, no, there's
Exactly.
there's no. I'm like, yes, there is though. What is it? Or what's the positive to yelling at my spouse? Oh, that's just bad. I'm like, no, it does feel good in the moment. Or doing cocaine would be fun in the moment. But then we
takes
move.
a while to train them that way.
Yeah, because there's a reason we do that stuff. Yeah, would it be fun to ditch work for 2 weeks straight? Yes, probably would. Would it be fun to not be able to pay my bills? No, it would. Yeah.
That's
Exactly.
That's a good example of an appeal to any therapist or workers, for that matter, anybody who works with clients in the criminal justice system. If you're doing any type of forensic stuff, you do have to be open to hearing some things that you completely disagree with on a fundamental level. And that's okay, because it doesn't necessarily imply that they're going to engage in that. That reminds me of a conversation I had with a client. He told me, so he said he got kicked out of another substance abuse program after he had completed the entire thing. And I was like, what do you mean? And he said, well, I was going through my relapse prevention plan, and one of the questions I thought was a trick question because of the way I answered it. And I was, well, what's the question? And he said, the question was, how can you guarantee that you'll never use drugs again? So he said, and this was to a judge, he said, I can't guarantee that. What I can guarantee is that I will continue to use my coping methods that I've already learned, and I will pay attention to risk factors that I haven't already planned for, and adapt my coping methods to those. And I will do that to the best of my ability to prevent a future relapse, which I thought was...
You got booted for that?
Yeah, I thought that was a very measured answer, and I thought that was very well thought out.
That's how we should answer that.
Right, and he said because he couldn't guarantee that was never going to happen again, that he was kicked out of the program towards the end, which sends... So that message to the client says, tell me exactly what I want to hear, otherwise you're getting booted from the program.
Yeah.
I guarantee.
So if he just said that, I think it's okay that they experience some of those things. And even when it comes to one of the last self-control methods that I think is important to talk about is just taking a break or using a distraction. And they might bring up something that, for me, it's not necessarily a distraction that I would want to engage in. Mm-hmm. But as long as it's not antisocial, in other words, it's not causing harm to them or others or breaking laws or rules or anything like that, well, it's really none of my business, So I think there's kind of sterile answers where I'll say, well, what could you do to distract yourself? And they're like, well, I don't know. I guess I could read a book. I'm like, okay, cool. Are you an avid reader? I haven't read in years.
Yeah.
Well,
again, if you're not going to do it,
then that's not going to distract you, right? But I remember on a group that we were running, we had a shared office space where we shared with other therapists, and one of the clients said a video game. And I said, well, great. That's an excellent distraction if it takes your attention away temporarily from the issue, right? And he described it as it was just a video game on his phone. I think it was Angry Birds or something. And he said, yeah, when I get that way, I pay attention to that for like 3 minutes, and then I come back and I can think about it better. I was like, excellent, keep doing that. And then somebody in the following class, another therapist or somebody else wrote, "This is not a distraction." Next to.
Oh, yeah.
Yeah, remember that?
Yes.
So what I'm saying is, look, I might disagree with that as a distraction for me personally, but I can't throw my own values. If a video game is going to take their attention away, that's the intention of that. The intention is not like, okay, well, we're going to mandate that you guys all start stamp collections because that is so pro-social. Like, I mean, that's foolish. This should be something that they legitimately enjoy, that legitimately grabs their attention. And the way he described it was, he's all, I love that game, and I deliberately don't play, so when I do play it, it is meaningful to me. And I was like, oh,
smart.
perfect, good for you.
Yeah.
And then somebody to write that on the board, man, what a shit message to send to clients. So just don't do that.
Yeah, don't do anything you like. Yeah.
Well, it sounds like that therapist that wrote that was maybe conflating coping temporarily with an emotion with a solution for the stressor, and that's not what Angry Birds does for that client. It's not meant as a solution. It's meant as a way to turn down the volume so that you can be more effective at dealing with it. I guess that completely sailed over the other therapist's head.
Exactly. So on this, the idea of a self-control strategy is kind of interwoven into those 3 steps that we said before. So if I am dealing with negative and stressful life events, the steps to going through this, if I'm a client, and for therapists too, I mean, you guys could just write this down, really simple. Step 1 is decide how I'm feeling, and have some thoughtful moments about what exactly am I feeling. What is the emotion that I'm feeling? Accept the fact that I am having an emotion, and then go from there, because that's going to help you determine which self-control strategy you're going to use. If you skip that step, you're not going to know what's the most appropriate self-control strategy. Step 2 is describe to yourself what happened to make you feel this way. You have to kind of know the activating event, because if we continue to engage in that activating event, that's going to stress us out even more. So if that requires that I create some physical and mental distance away from that, fine. Again, that kind of dictates what we're going to do in our self-control strategy. So step 3 is identify the self-control strategy, the best self-control strategy to manage your feelings. So I go through the list that we've just given you, counting backwards, visualization, self-talk, or using a distraction, taking a break. And based on where I am in that moment, you pick one of those. It doesn't necessarily need to be anything that would throw you off so much that, I'd bust out push-ups in front of a boss, and have an interview or something like that. Yeah, I agree with you. Don't do that. Do something different. Give yourself a couple of self-talk to yourself in your head while you're talking to this boss. He's not going to see that. You're not going to look like a weirdo. Easier when you kind of apply those, which one am I going to use? And then step 4 is pick the best self-control strategy and do it. Okay? Think that through, go through with it. And again, remember what we're going after. The intent there is, if I'm at a 70, I want to go to a 65. Like Jeff said, I want to turn down the volume just enough that I can think through this issue clearly and come up with a reasonable solution, or at least bring this up to another person, namely my therapist, and have a conversation there and work through that issue. So that's kind of it in a nutshell. Or maybe
you said it well.
Yeah. Yeah.
What's another euphemism for nutshell? Or no, sorry, idiom for nutshell.
For like in a nutshell. Let's see. I don't know. Yeah. There's got to be plenty, but
yeah. Well, we just talked about 5 guys in my mouth, so I was just saying.
Yeah.
Nutshell.
Oh yeah.
Probably want to come up with another one.
Yeah.
For that.
We'll work on it.
Okay. Well, so any other thoughts on this?
Well, I'm good winding up.
That's a pretty good place to wrap up. Right?
Yeah.
Yeah.
Okay.
Here comes the outro.
Bye. All right, that does it for this episode of the podcast. We will be back on the next one here towards the end of June. We're going to have fellow alpha therapist Ryan Stokes on the show. We're going to be talking about coping with anniversaries and holidays. Is that what it was? Dealing with the stress that comes from that. So tune in then. See you later.